time to grow with the SEO Queen. Receive the perfect leads like never before. No traffic is gonna explode. It's time to grow.
Welcome to the SEO Queen Tech Show, a podcast to help you get more credibility, visibility, and profitability through inspiration, technology, and marketing insight. This podcast is for professionals and entrepreneurs who are looking to get more customers, clients, and patients. We are broadcast worldwide on Bashani Radio, iHeartRadio, and iTunes. Bashani Radio, always talking about everything from New York City. You can listen to the SEO Queen Tech Show on any mobile phone or tablet device. Also, as a thank you gift for listening to the SEO Queen Tech Show, you can go to SEOqueen.com and download the free ebook, 101 Ways to Improve Your Marketing and Sales. Today, we have a treat for you today. We have retired medical school professor, doctor, and expert researcher on Thoracic Outlet Syndrome, Dr. Carlos Selmonosky. How are you today, Dr. Carlos Selmonosky?
Very well, very well. I'm doing all right. I'm looking forward to talk to you.
Oh, okay, great. So I just want the listeners to know that you have been in the medical field for quite some time. So I want to know, like, when did you get an interest in the medical profession?
My father was a family doctor in a working neighborhood of Buenos Aires, Argentina, and he really pushed me to be a doctor. And then when I was in the middle, I liked it, and I continued my education, became a doctor, immigrated here to the United States, and have a nice career. You see, I couldn't do that in Argentina, but America gave me the opportunity to really write papers. I wrote a chapter of a book, and I gave many conferences. And he gave me the opportunity to progress and try to find things to help people.
Okay, that's awesome. So I mean, you can decline to answer this question or not, but I just want the listeners to know that you are a very young, how old are you?
I'm almost 90 years old. I will be 90 in December.
Oh,
wow. But I have to tell you, for my neck up, I'm 35.
That's awesome. You're young at heart. So you were born and raised in the land of Eva Perón, Argentina.
Correct. Yeah.
Yeah, you know that the musical Eva Perón, the movie became really popular all over the world. So,
yes.
So
he was something. I have my relatives know her very well.
Oh, some of your relatives knew her?
Yeah, it was a very difficult relationship because when she went to become a power, my relative, who was a tango composer very well known in Buenos Aires, had to leave the country.
Oh, wow.
And then Eva Perón said, don't worry, just come back. I won't do anything. This can be documented.
Was your relative involved in a romantic relationship with her?
About something like that, you see.
Oh, and, yeah, I would have stayed away too.
He was a very way. Anyway, he came back. Okay, that was I remember my time, you see. But it was a difficult period in Argentina.
Oh, wow. That is so cool to chat with you. You know, having, history is something else when you can talk to somebody who has a connection to the person of interest.
Exactly.
Yeah, so,
I mean, that was people talk about things, but they had to be there to really understand what's going on.
Yeah, absolutely. So your father really pushed you to be interested in medicine, and then you just really took a liking to it. So throughout your career, you shared with me before we started the interview that you were on the faculty at a medical school. Tell me a little bit about that experience.
I was in the faculty of Albert Einstein College of Medicine when I was training. Then I went to England and I was a teaching institute at Hammersmith Hospital. Then I became a member of the University of Iowa for 3 years. And then I became an assistant professor and the Medical College of Georgia in Augusta, Georgia. And then when I left there for Atlanta, I became an assistant professor in one of the other schools in Georgia. There's another school in I don't remember the name now, that I spent about 5 years. I used to teach medical students. Mercer University.
Okay,
And
okay.
then
Wow, that's awesome.
it's
So,
very nice. I was very pleased.
so teaching at Mercer University, I'm sure you got to meet some interesting people. So I want to know what caused you to be so passionate about thoracic. I want to make sure I'm saying this right. Thoracic Outlet
Syndrome.
Syndrome. Yes.
Perfect.
What?
Yes. Okay. I tell you why exactly. I was in Augusta the first time. I bought the home for the first time, and I have chest pain. I say, "Oh my God!" I was about, I don't remember, 45 something like that. And then I went there. I went to the cardiologist. I said, "Please look at me. I don't put me in the record because I'm insurance will go down. I already have 3 children already." And they look at me. They couldn't figure out what I have. Finally, I called my ex-professor in Iowa, and he guided me that this may have been thoracic outlet syndrome because he remembered a case. And then I start to look, and then after many years of being sure that what I'm saying was correct, because what I'm saying is really quite, for example, one of the signs of thoracic outlet syndrome is called the white hand sign. And I say, why I have seen dozens and you haven't seen any? The reason is that they don't do the proper physical examination. Anyway, I became interested. I present papers. I seen that the first one it was in 2002, I think, 2001. And I became interested, and I found that I was much more frequent than we think about.
So this thoracic outlet syndrome, you can tell if you have it if you have a white hand sign. Now, how long do you have to have your hands elevated above your head before?
Yes, it depends. It depends how severe the disease is. Some people, I have to go in a special way. If you go to the web page, there is a picture how to do it. You see,
Oh, okay.
and people who are severely compressed, it takes a few seconds. Sometimes take 1 minute, and if it doesn't come in 2-3 minutes, it's not there.
Oh, wow. Wow. That's
And
awesome.
they are
So,
different grades. Sometimes it's so the flow is so compressed. The arteries have been compressed at the thoracic outlet that it's practically look like cadaveric. Look really very bad.
so this thoracic outlet syndrome, what is it? What
It is
exactly is it?
it's a compression of nerves, arteries, and veins in the area in the neck, in between the clavicle, you see, behind the clavicle. And it produces symptoms in the upper extremities, pain, paresthesia. Paresthesia means tingling, feeling, numbness, you see. And then it can produce shoulder pain, neck pain, and sometimes chest pain. And sometimes the chest pain is not diagnosed as well because 80% of people that go to the emergency room because acute chest pain don't have acute chest pain. And they keep asking the doctor, where my pain come from? And the doctor says, it's not from the heart. But many of these people have thoracic outlet syndrome. And I send you an abstract I presented in Rome some years ago about
You presented an abstract in Rome?
Yes, I sent you the copy to you
Yeah.
about that problem, about that you should rule out thoracic outlet syndrome when you see a patient with chest pain and you rule out coronary disease. Then you have to think about thoracic outlet syndrome, and very few people do that. You see.
Wow. So this is like a test that all doctors should do when patients come in complaining of chest pain then.
Correct. No, first they have to rule out that don't have an acute coronary event, of course.
Of
No,
course.
first you rule out that you don't have it. You have to have EKG, you have to do that enzyme, you have to be sure that you are sure that the patient don't have coronary disease, then you look for thoracic outlet syndrome.
Oh, wow. So, I know that you sent me early detection white paper that you wrote. It's early detection of renal failure after
Yes, that's
cardiopulmonary bypass.
okay.
So, go
This
ahead.
is a this is a complete different issue. You see, I found out many years ago that I could predict when a when renal failure started. And if you know that, you can start therapy because usually renal failure is diagnosed 12, 14, 15, one day after, or it's too late. Once that the renal failure is established, you cannot do anything. You have to go. If you are lucky, you survive. If not, you have to go to dialysis or renal kidney replacement, or if you survive, you have chronic kidney disease. And unfortunately, nobody pay attention. Nobody can say, Dr. Selmonosky, you are wrong. I talked to many important and famous people, and they say to me, you look good. I say, why don't you do it? Well, I don't have the money to do that. But nobody has told me, oh, you are wrong. This is not, means that it's still possible that I'm correct. If I'm correct, the benefit to the patient will be enormous and the saving to the system will be in the millions. But nobody has replicated my findings, or at least say, no, Dr. Selomonosky, you're wrong because of that, because of this. And I'm hoping that somebody pick up the how can I say, the guidance to really diagnose acute kidney injury or renal insufficiency quickly. That would be a big thing.
Yeah, I mean, I know I have a friend right now who's waiting for a kidney transplant right now, and then my
Right.
boyfriend, he also has a friend that is dealing with dialysis and a bunch
Yeah,
of
it's a
issues.
big
So
thing.
so you've done research on a way to detect renal failure before it occurs?
Exactly. Yes. It's a very
Okay.
simple method. It's described very well in those articles I sent it to you. It's very well described there.
Okay, well, for our listeners who don't have the article in front of them, how can you detect whether or not you're experiencing renal compromise?
Okay, what I do, I check the urinary urea concentration every hour. And what happens is the urinary urea concentration is practically a reflection of the function of the kidney. And suppose it's 11, suppose it's 1,000 milligrams per hour, or anything. And then you see quickly it went to 500, went to 400. At that moment is when you know that the kidney is being damaged and you can start to proceed, and do therapy, see how it goes, you see. It's called the
So,
hourly urinary urea concentration.
oh wow! So all you have to do is just analyze your pee to every hour to determine whether or
Exactly.
not. Oh
So,
wow!
most of the people who have that, they have a catheter, means, we were trying to design a urinary bag that will measure that every hour and how
Hmm.
much urine you produce, and then send information to the nurses with electro engineering from Argentina. But then all this virus stopped the production. We had to wait again. But I think that it's so simple that it's just tremendously, it can be done very cheaply.
Well,
But nobody has done.
well, this is something that I definitely think that should happen because I know that dialysis is something that
Oh,
Black
oh,
people have to deal with
black people,
disproportionately.
exactly. But black
Hmm.
people have a tremendous problem because of socioeconomic reasons. You see, they eat too much salt, they eat too much bad things, not because they want, because they don't have access. And they don't have access to medicine, to preventive medicine, and then they develop a very bad arterial hypertension and very bad kidney failure. It would be very good for the Black community.
Wow. So this is very, very interesting. So when it comes to innovation and research in the medical space, what do you think is contributed to your success in finding low cost and innovative ways to determine whether or not a person has, thoracic outlet syndrome or experiencing renal failure?
Well, my father was a very good clinician. He used to make diagnosis, and when I was in the medical school, I used to call him, Daddy, how you make diagnosis? He couldn't tell me. He has that, how can I say, innate feeling. I have the same thing that he had. You see, I don't know if I call it intuition. I don't know how to call it, but I had this feeling of finding things, and money was not my purpose to do medicine. On the contrary, my webpage, I support my webpage for 25 years. I did write a chapter of the book, and I did the conference. All I pay for that, you see. And I have this, I don't know, this feeling, this desire to know things about medicine.
Oh, wow. So we know why renal failure, being able to detect it early is so important, but why is thoracic outlet syndrome detection so important? And how
Because
can it change the patient's life?
it's more common than we think. People go to the doctor and say, I have neck pain. If you look at the literature of neck pain, about 30-40% of neck pain, they don't know where it comes from. The same thing with the lumbar pain, or lumbar pain is so common, but in many instances, people don't know what it is. And in the upper extremities and in the chest is thoracic outlet syndrome. In the lower extremity, another thing that's being misdiagnosed is piriformis syndrome. Piriformis syndrome also is misdiagnosed in the lower extremity. But thoracic outlet syndrome is much more common than we think. If you look at people now, especially with the screen, everybody's hunched. You go to school and everybody's hunched. You go to the offices, and the secretaries are hunched over computers. And the surgeons are hunched over. And I go to the office because I'm at 90 years, I have problems. And I check all the nurses, and check the fingers, to do the diagnostic triad means that you have weakness of the fifth finger. And I found that many people have thoracic outlet syndrome, but they don't know because it's a muscle pain. It's a muscle pain. It's my bone, and it's thoracic outlet syndrome. If you get thoracic outlet syndrome early, you can put posture. Posture is so important. Everybody hunches now this day. I don't know if you noticed that or not.
Well, I know that posture is very important, and I'm actually you'd be happy to know that I'm sitting in a very ergonomically effective desk.
That's very good. Yes,
I have a desk that's slanted up with a rest,
perfect.
and my back, the back of my chair is straight up and down, and the seat is hard, so it's not
Perfect.
soft.
Perfect.
I'm not, and I had to get better with my posture because I started feeling a little pain in my hip. And so it went away. It went away. I was warned, but so I'm definitely trying to keep my posture better. So
Right.
so you're telling me that thoracic outlet syndrome's cure is just better posture?
Yes. No. When you do, you may have the anatomical predisposition. So, for example, you may have abnormal ribs or abnormal tissue, fibromuscular elements. You see, but if you hunch, you kind of produce the symptoms. You see, if you keep your posture, maybe you were able to not to have the symptoms. You see, if you have the symptoms, in fact, everything that you do, you may have to have surgery, but only after you do a good posture. But the problem is, once that you have symptoms, it's difficult to 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 get better. You see, maybe about 30-40% of people have to have surgery, which is crazy. But if you can make the diagnosis early, then you can start to teach the students. I go to classes and they are all hunched. You see, nobody say. I can remember my mother say, "Have a good posture." I remember in my time, mothers used to say, "Have a good posture." You see? But now nobody. If you start to work at that time early, you may avoid surgery or complications.
Wow. So posture is so important, and
Yes,
having good
very
posture can prevent nerve damage and a whole
right.
host of other issues. You know, you
Exactly.
know, my son is a avid gamer. He loves the game. He loves,
Oh,
on his
I know, I
computer.
know.
And I have to take it from him because he's already been complaining of some neck pain, and I
Exactly.
emphasize to him the importance of good posture. And so this is definitely something that we need to make great again is good
Yeah,
posture.
and all the office has to, like you say, have an ergonomic approach. I go to the office, doctor's office, and I can see the secretaries hunching over. You know what I do? I lift up the computer, I lift up the screen to the eyes. Oh, I feel much better. You see, but
Right.
nobody, nobody, uh, not no nobody. I would say nobody, but many offices and places of work don't follow any ergonomic principles. You see, they
Right.
should.
Yeah, absolutely. Absolutely. So, if you are, for the entrepreneurs that are listening to the show, what three recommendations would you have for them to keep a workplace that's ergonomically effective?
Well, if you look at the internet, there is many places where you can find about good posture. I have books about with figures about what to do, when to put what elevation, like you do, what level you have to put at the desk, what is your chair. This can be achieved, and there are people that know ergonomics, and there is very good places where they have an ergonomic kind of physical therapy, whatever name you can give it, that try to find a solution to this problem, especially also about the carpal tunnel syndrome. Everybody suffers carpal tunnel syndrome. Is more than 500,000 operations a day. I'm sorry, a year in the United States. And sometimes the results are not as good because they miss thoracic outlet syndrome.
Mm.
Not
Yeah.
everybody. I would say everybody, but people who has carpal tunnel syndrome, the doctor should check you for thoracic outlet syndrome, should check you for weakness of the fifth finger. If weakness of the finger is present, then you have something more complicated than carpal tunnel alone.
Wow, that's really,
That's
really,
heavy. That's heavy. That's heavy because
it is.
what I'm saying is it's really heavy because if I'm wrong, I'm very wrong. But if I correct, it's really important.
Well, I mean, what you're saying makes a lot of sense to me. So I hope that some other researchers will, um, duplicate the research you've done to confirm your findings. I hope that happens.
It's very difficult. A new idea takes many, many years in flourishing. You see, I don't compare to them myself but remember, ulcers of the stomach. Somebody found out there was bacteria for 20 years. Nobody pay attention. Now
Right,
we take an
right.
antibiotic. I mean, I don't compare to them. I'm not compare myself to them. But it's a story. A new idea is very difficult to overcome the old idea. It's just, I talk to professors, and then I show them that they have a weakness of the finger. And they say, no, that's normal. I say, no, it's not normal. If you have a fellow who work 5 or 6 days a week, more than 8 hours a day, that use the upper extremity frequently and forcefully, the strength of the fifth finger is the same to the strength of the second finger. And if you go to martial art, the teacher of martial art, because they are using that, and they have a good posture, you see,
Right,
and
right.
and it's not normal to have a weakness of the fifth finger, and I fight in that, but I just I hit my head against the wall. I don't know which is the strongest.
Wow, wow. So how can people connect with your website and learn more information about you and your research?
Well, it's the name is www.tos time Oscar Sam hyphen syndrome.com. And I hope, somebody can help me to bring back that app into the Google list, you see.
Oh, absolutely, absolutely. So I definitely want to encourage all the listeners to check out TOS hyphen syndrome.com. That's TOS
Correct, correct,
hyphen syndrome.com. Well,
correct.
Dr. Carlos Selmonosky, it definitely was a pleasure having you on the SEO Queen Tech Show. And we are broadcast worldwide on Vashani Radio, and we're on the iTunes and the iHeart apps as well. I just wanted to ask you, do you have any final comments before we?
Yes, yes. I have a final comment. It's a comment, a contribution to you. You have a very brilliant mind, and it's so beautiful to have a discussion with a brilliant mind. They are not very common.
Well, on that note, I'm going to say thank you so much. And it definitely was a plum pleasing pleasure to have you on the show. Thank you so much,
Okay,
Dr. Selman.
thank you very much. Thank you. Glad to know you. Thank you.